Dr. Nicole Rogerson, who's the head of Autism Awareness Australia. Nicole is in the studio with me. Hi there. So why is it that some kids from poorer areas have to wait so much longer than others for a diagnosis?
You don't need to be a rocket scientist to figure out this one. It's as simple, it comes down to funding. We're looking at families in affluent areas, see the waiting lists at public hospitals, realise how long it's going to take to have their child assessed and to get a diagnosis, so they move on to the private sector to get it done there. It's as simple as that.
So what impact can delaying intervention have on a child's condition and future, of course?
It's life-changing. You know, we know that the early intervention is the most important. We know we need to start with children as young as. I think what's really interesting here as part of this story, though, is the Minister has been saying that families don't need a formal diagnosis in order to get some early intervention supports within the NDIS. And whilst that is true, that's not really what's happening on the ground. What we see is an enormous amount of confusion with the early childhood, early intervention gateway into the NDIS. So families think that they have to wait in the hospital system and they can't move forward without it.
So once you get an official diagnosis, what help is then open to you?
Well, this is what has changed. The NDIS has changed significantly in this area. There is help and there is funding available, and early intervention is so key. The problem is all of these families are being held up in the hospital system and they can't get through. So what we're seeing here is failure of governments on a couple of, and I'm saying governments because it's state government that absolutely has to fund assessment centres in public hospitals.
Well, there is a toing and froing as to who is responsible for this between the state and federal government.
You know what they're going to do with that, right? Everybody's going to, blame the other team. But the reality is we're talking about little kids. We're talking about families. We need action on this now.
So are the parents of kids who are living in areas where they are more disadvantaged, are they finding that they're having to go private and wearing the expense of that?
Sure, but obviously for a lot of families, even that's not possible. We're talking about assessments that can cost anywhere between $1,000 to $2,000. So they're obviously just not funds many families have, so they have to wait in the hospital system. So the hospital system, while they are doing some good work, I know through the Children's Hospital Network in Sydney, they're working with the University of Sydney on a transdiagnostic tool. Everybody's talking about it, everybody understands it, but we need it to change. And I think this report just did a really good job of kicking governments up the butt.
So what's the advice for parents who are facing a long wait for an appointment to get their child assessed? What would you say? You're the mother of a child with autism.
Yeah, that's
yourself.
right. Yeah, he was an adult now, but yes, I certainly know this period of time and how stressful it is for families. So I would say do not wait. Get onto the early intervention childhood gateway with the NDIS. Go onto the website. You don't need a formal diagnosis. Stay on that waiting list. Absolutely, someone will get to you. And a lot of us are going to rattle cages to make sure we can get you there faster. But in the meantime, early intervention has to start. The things that you do with your child can start now, and get onto the NDIS because it's not a blocker and there's no reason not to get help that you need straight away.
It sounds like this has been a frustration for you for a long time.
This has been a frustration since my child was diagnosed in 1999. So this is a long issue and state governments need to address it.
Dr. Nicole Rogerson, thank you so much.
Thanks so much.
Compared with their counterparts in more affluent parts of the country. The ABC can reveal children are waiting up to 2 years in Sydney's southwestern suburbs for a diagnosis, often needed to access the National Disability Insurance Scheme. That's compared to 2 to 10 months in inner city areas, and it's a similar situation across the country. Our political reporter, Stephanie Dalzell, has been battling with the vagaries of the Freedom of Information system across the country for months now to get this story. She sat down earlier with the Minister for the NDIS, Stuart Robert.
Minister Stuart Robert, thank you for joining us.
Pleasure.
Why are children with disabilities waiting up to 700 days for a diagnosis?
That's a question you should ask a State Health Minister, because the State Health Ministers are responsible for their state hospitals. So putting that aside, that is a state health issue, remember under Section 25 of the NDIS Act, if you have a child under the age of 6 that you believe has development delay, you can take them straight into an early childhood, early intervention partner. You don't need a diagnosis to seek access into the NDIS.
So you say you don't need a diagnosis to seek access to the NDIS, but the parents that we've spoken to, paediatricians, even the AMA say that you do need a diagnosis sometimes to access the NDIS. Why is there such a disconnect between what the government is saying and what parents and families are saying is happening on the ground?
Well, I'll tell you what the law says. So Section 24 of the Act says if you've got a permanent and significant disability, you'll need a diagnosis to access the NDIS. But Section 25 is specifically designed for early childhood, early intervention, so development delay. Under Section 25, if you've got a child from 0 to 6, they can gain access under the early childhood, early intervention pathway to get that early intervention. And of course, course, once they turn 7, that's when a diagnosis is necessary for them to continue into the scheme.
So that may be technically true, but the families we spoke to said they couldn't access any early intervention funding until they had that diagnosis. Now, these are children under the age of 7.
I encourage all families, get onto the NDIS website, call their early childhood, early intervention partners, 18 around the country, and if they've got any concerns, to take their child in and have that discussion with that early intervention partner, because that's what that stream is there for.
Well, you're encouraging them to have a discussion, but the AMA is encouraging you to have a discussion with the NDIA, saying that you're potentially out of touch with what's actually happening on the ground. Is that a possibility?
No. I'm pretty clear on how the NDIA runs. I run the organisation. It knows its responsibilities under the Act, and it knows it needs to get children in quickly, and it's doing that. The quarterly data came out yesterday, and it shows that access decisions for children into early intervention is 3 days.
We're not talking about access decisions here, though. We're talking strictly about a diagnosis. Why are families telling us that they're not able to access NDIS funding without that diagnosis?
Well, I'm telling you that's incorrect. You can access funding under the early childhood.
So the families are lying to us?
No, I'm simply saying that the pathway is available right now. Families need to go right now into their early childhood partner to get access for their children, and if they're having trouble with that, they should contact the NDIS, or they can contact their local MP or contact me, because the law is very clear, my agency is very clear, the pathways are very clear. We are absolutely committed to taking care of children in the early childhood pathway, and access right now. 6 months ago it was 43 days. Today it's 3 days from speaking to an early childhood partner to access into the NDIS.
Just to get back to the diagnosis, aside from, the NDIS funding, if we accept the government's claim that you don't need a diagnosis...
If you believe the law, and the law is clear.
If I accept your version of events over the families I spoke to, a diagnosis is important for other reasons. It effectively explains the reason why a child has a developmental delay. Is it acceptable children are waiting up to 2 years to find out the reason behind that developmental delay?
Of course not, but that's a question you should ask a state health minister that runs it. Now, having said that, I've anticipated all this. We've started a second trial into functional assessments. That trial will finish in a matter of weeks, and all going well, and it seems to be going well, we'll go to market for a functional assessment partner, and from 1 July we'll start a functional assessment as the basis for access. And that's designed to make it a lot more quantifiable, a lot faster for people, and that way the issue is not questioning their disability, but looking at what function they have and what level of support they'll need to speed the whole system up. But I don't run state hospitals.
So it is a state issue, but the states say that the rollout of the NDIS has put increased pressure on the state-based diagnostic teams in public hospitals, and that they need extra Commonwealth funding. Is that something that you would potentially consider?
No, because it's wrong. So
they don't need more funding?
The NDIS is replacing state-based supports. So parents with children with development delay, the same numbers we have now are the same sort of numbers we had 2, 3, 4, 5, 6 years ago when states ran disability services. So all the NDIS is doing for permanent and significant disability is replacing what the states initially ran. So this is not a huge surge of people coming through. We've always had children with development delay, and the states have already dealt with it, or should have been dealing with it. So why is it now state hospital systems are saying there's a particular problem, especially when federal government for funding for public hospitals has increased by 66% over the last 6 years? So the states have always had this responsibility.
You're the federal minister responsible for the NDIS scheme. Aren't you concerned that children are waiting up to 2 years for a diagnosis, and wouldn't you want to see that rectified, and wouldn't you then potentially see if you could take money out of the NDIS to help them speed up that diagnosis process?
Well, under Section 25, I know you don't need a diagnosis to access the early
But as I
childhood
already
pathway.
explained, there are other elements. As I said, there are other reasons for a diagnosis, including working out the reason for developmental delay. It's important for other reasons as opposed to accessing the NDIS.
That is a state responsibility. And it's very clear we understand what's state and what's federal. Now, I know everyone wants the federal government to solve every single problem, but we can't. States have primary responsibility for healthcare at that state hospital level, and they are responsible for it.
Have the states raised this with you?
They have not.
Will you raise it with the states?
The state health ministers are very clear on their responsibilities. I'm clear on mine, and I'm also clear You don't need a diagnosis under Section 25 under the Early Childhood Pathway. And I encourage parents, if they're having any issues, to contact the NDIS or indeed their local Member of Parliament, or contact my office.
So the federal government at this stage doesn't have any plans to ensure that kids wait longer for a diagnosis?
We don't have any plans to step in and solve the failings of state hospitals. No, we do not, because that's their responsibility.